Okay, this video is called There's No Money in Helping You, You Are on Your Own. Okay, now here's an anonymous quote. A patient cured is a customer lost. The motto of dental school is drill 'em, fill 'em, and bill 'em. The motto of medical school is match the ill to the pill and send the bill. If a patient is put on a pill for a disease, they typically take that pill every day. They typically need to come for follow-up visits. Most pills are of little benefit. Don't get me wrong, some of them can be very useful. I've seen people have their lives saved by antibiotics. Obviously, HIV patients live much longer than they used to. There's pills that people absolutely need, like thyroid replacement, Parkinson's disease, or L-Dopa gets them moving a lot better than they otherwise would. And there's plenty of other situations where pills have a really significant benefit. But overall, for the chronic diseases, they're very much exaggerated, overrated. And by that I mean things like diabetes. Okay, what's the cure rate for pills with diabetes? It's 0%. Never cures the patient. That's why it's called a chronic disease. What's the cure rate for low-fat vegan diet for diabetes? Type 2. It's about 100%. Okay, if the patient is started on it early. Now, the big catch with the idea of low-fat vegan diet is that very few patients are willing to follow the diet. I've been amazed. I would guess in my experience, maybe it's about 2%. You'll hear, Dr. Esselstyn, quote higher patient follow-up numbers than that, but that's because those are patients who have sought him out. They know about him and they want to go for it, okay? Versus the average person who's just fat and sick and ignorant and doesn't really have a deep understanding of the problem will typically say stupid things like, my diabetes is under control. It's under control. It's under control. They have no idea what that even really means, but the fact that they're very sick. And that's the vast majority of people. So what I'm trying to say here is, for the last 35 years, from my experience in medical school and as a physician, it's the same stuff. The patients are sick with the same diseases: obesity, hypertension, diabetes, sleep apnea, myocardial infarction, coronary artery disease, cerebral vascular accidents, gastroesophageal reflux disease, cancer, dementia. It's the same thing. And there's been very little improvement in therapy. And then there's all kinds of razzle-dazzle fancy stuff. You talk about coronary artery stents. Those do not significantly affect the patient's mortality. Okay, they really make very little difference. Open heart surgery for coronary artery disease. These big, hyped up, super expensive things. And I think the reason is patients want a quick fix. Oh yeah, they'll sign the consent in 2 seconds. I couldn't believe it. I did a surgical internship, and the patients would sign the consent in 2 seconds for open heart surgery, for craniotomy, you name it. And they're the exact opposite of how I would think. I don't want somebody to cut me open. Are you kidding me? If all I got to do is eat a salad and some starches and some fruits and I could avoid open heart surgery, it's an easy decision. Okay, for an intelligent, well-informed person. But again, most people think, well, I'll just take this pill, I'll just get the surgery, then I'll be done with this problem. And I don't have to change anything. That's a very lazy, ignorant way to view things, and it leads to relatively poor outcomes in comparison with getting one's act together for diet and exercise too, but primarily diet. And of course, the other things, get your sunshine, manage your stress, all that. The big money in medicine comes from selling drugs. That's the main thing that doctors do, in a sense, is make money from selling drugs, if you will, indirectly, directly, whatever you want to call it. Laboratory tests, procedures, CAT scans and surgeries, that's where there's big money. And don't get me wrong, a lot of patients do benefit from that. But the vast majority, the bulk of patients, have these chronic diseases and they are treated with pills, and they often end up taking 10 or 20 per day. And I think it's also in part because the patients don't realize that the pills don't work that well. They have this inflated sense of pills' value. And what I mean by you're on your own is if you just optimize your diet and lifestyle, basically you prevent all these diseases almost always, and you don't have to waste any money on pills or surgery and go through the painful expense. I'm just about 59 years old. The only surgery I've ever had was I had a cauliflower ear as a wrestler, and they drained it once. Okay, that's it. And that's all I expect to ever have my whole life, I hope. So, anyways, hope that's helpful.